This is the first in the series of training videos to introduce medical volunteers to the electronic medical record system currently in use at Mission of Hope International, Grand Goave, Haiti, and eventually in Nicaragua. In this video, we will look at the format known as SOAP for formulating and documenting patient clinic visits, and which is the formula used in the EMR that we have adopted. This should be very familiar to most physicians and mid-level providers, but I encourage you to spend the next few minutes in this review before going on to the next video in the EMR itself. SOAP is an acronym which stands for Subjective, Objective, Assessment, and Plan, and is the widely used and recommended format for medical notes documenting patient office and hospital visits. Subjective is what you hear from the patient. It includes the patient's complaints, symptoms, and history in words as close as possible to the way in which he describes them, with editing by the examiner only for clarity and brevity. Both direct statements by the patient and answers to the examiner's questions are recorded here. Some examples. I fell 2 months ago and my back has hurt ever since. Frequent headaches. I was given blood pressure medication several years ago, but I don't know the name. Denies chest pain and palpitations. And this last example is clearly a response by the patient to a question from the examiner. Objective is what you observe. It includes all the hard data obtained by the examiner through physical examination, observation, and all additional means such as laboratory and radiologic studies. Height, weight, and vital signs certainly fall into this category, but may appear elsewhere if they have been previously obtained in a triage setting by an assistant. Examples include PERRLA, a common acronym standing for Pupils Equal, Round, Reactive to Light, and Accommodate. This is part of the neurological examination. RALS at the left lung base posteriorly, information obtained by listening to the lungs with a stethoscope. Skin is red and scaly with scattered vesicles on upper extremities. This is clearly simply observation. Forearm bent 30 degrees, midway between elbow and wrist. Also observation. Assessment, then, is what the examiner thinks. This is the impression of the patient's problem based on the information obtained above and should be as specific as possible without assuming more than is supported by the data. It may be a diagnosis such as broken arm or shingles, if that is obvious, but more often may reflect varying degrees of uncertainty. Each of the patient's complaints should have a documented assessment, unless several can be related to a single disease process and be included in a single assessment. Examples include symptoms suggestive of urinary tract infection in a patient with urinary burning, frequency, and foul-smelling urine, UTI, urinary tract infection, in the same patient but with urinalysis confirming pus in the urine. Chest pain of uncertain etiology, in which history from the patient is unrevealing and examination of the chest is normal. That can be upgraded to chest pain compatible with musculoskeletal etiology if the patient has tenderness in the area of his pain. Probable viral URI, upper respiratory infection, in a patient with fever, non-productive cough, aching, and headache. The probable here is important because we don't have access to viral cultures routinely, and we can never be 100% sure if that's what it is. Clinically, however, that is our impression. Plan is what you intend to do. This is what is to be done for the patient and includes injections, immunizations, prescriptions, additional lab and x-ray testing, referrals, follow-up, teaching, recommendations, reassurance, and so on. All of a patient's complaints and examiner's assessments should have a plan, however brief. Keep in mind that some plans may have to be made based on incomplete data. For example, prescribing antibiotic for urinary tract infection symptoms without confirmatory urinalysis if that test is not immediately available. Examples include schedule x-ray of foot, reassurance regarding chest pain, and follow-up if not resolving or if worse, instructed in ways to decrease salt in diet, follow-up in 3 weeks for recheck of blood pressure, prescriptions as listed. This is the end of the SOAP Note module. Needless to say, all pertinent information will be typed into the electronic medical record, either in real time or, in the absence of internet connectivity, be legibly handwritten and then entered at a later time by the responsible provider. It is therefore critical that notes be not only complete, but succinct in order to avoid unnecessary keyboard entry time.